started.
Great, thanks very much, Jeff. I'll just start with an acknowledgement to country. As we gather for this meeting, physically dispersed and virtually constructed, let us take a moment to reflect on the meaning of place, and in doing so recognise the various traditional lands on which we do our business today. We acknowledge the elders, past, present and emerging, of all the land we work and live on, and their ancestral spirits with gratitude and respect. And I would particularly like to acknowledge the Wurundjeri people of the Kulin Nation on whose country I walk. So I'm Kylie Hesketh. I'm from the Institute of Physical Activity and Nutrition at Deakin University and Deputy Director of EPOC, so the Centre for Research Excellence in the Early Prevention of Obesity in Childhood, but that's a bit of a mouthful, which is why we abbreviate it to EPOC. I'll just give you a little bit of background about EPOC and then talk a little bit about what today is going to entail before handing back to Jeff to take over the main part of the day. So EPOC was established in 2016 with funding from the National Health and Medical Research Council. It brings together researchers, practitioners and policymakers from Australia, New Zealand and England to work collaboratively on approaches to the prevention of obesity in children with a focus on that birth to 5-year age group. The work of EPOC has really been around 4 key themes. One has been about bringing together data from various research groups in Australia and New Zealand and looking at what approaches seem to have the most potential benefit for the prevention of obesity. Another stream which Vicky Brown will speak a little bit about today is our economics stream, which has looked at the health economics around our kind of best bang for buck in a limited economic climate, what we can do to have the best impact on childhood obesity. One of the other streams has looked at measurement, so short tools to be able to really assess and evaluate programs that might be running around obesity prevention. And the final stream has looked at translation, so really trying to get some of the programs we've developed, one of which that we'll talk about today, the infant program that some of you may be aware of, how we can really scale those up into the community so that all children can benefit from those obesity prevention strategies. So EPOC is officially coming to an end this year, which is why we're focusing on some of these dissemination activities. But in exciting news, we have received another 5 years of funding from the National Health and Medical Research Council to look at EPOC Translate, which is going to have more of a focus on this translation aspect, which is what we're talking about mostly today. We've developed a number of evidence briefs that just summarise some of the work that has been done over the previous 5 years. And if you're interested, everything that I'm talking about now can be found on the EPOC website, which Conceda, I'm not sure if you want to pop that in the chat. It's www.earlychildhoodobesity.com. And today what we're focusing on doing is really bringing together people who work in the community with families, and what we're wanting to do is have this be a really interactive session to learn from you and see how we can kind of meld these learnings to do the best for children in our community. We'll be working, obviously, the policy context at the moment is quite exciting. We have a national obesity policy which is out for consultation at the moment, the National Obesity Strategy, which some of you may have commented on already, and there's a lot going on in our Victorian context as well, which Veronica Graham and Michelle Hollingworth will talk a little bit about in our first session. So today we're broken up the day or the morning into 2 sessions, and you'll get a 10-minute break in between at about 10:30. Each of the sessions will have some speakers initially to kind of generate some ideas and some thoughts, and then we'll break off into separate discussion group rooms, because we're really wanting everyone to interact and bring your thoughts and ideas about how we can work together moving forward to do the best for children around obesity prevention. And we'll also be looking towards the end of the session about exploring ways that we can continue to work together to keep the momentum going around early life prevention. Acknowledging that everyone's coming from different areas, different backgrounds, it's going to be really great to bring together all the different views and the different contexts that you're working in at the moment. So I'll hand back over to you now, Jeff, I think, to get things moving.
Fabulous. Thank you for that wonderful open pitch I can start to make. I'd like you to start thinking about that question as we hear people. Vicky, I'm going to hand over to you first.
Beautiful. And I've shared my slides, so hopefully everybody can see that okay. I guess, first of all, thank you for the opportunity to come today and talk about the value of preventing obesity in early childhood. So, as Jeff mentioned, my name's Vicky and I'm from Deakin Health Economics at Deakin University. And my slides are not moving. There we go. So I'll just jump straight in. So 1 in 4 Australian children has overweight or obesity before they start school. And we know that prevention is critical to reduce the health and economic impacts of early obesity. It's well established that overweight and obesity tracks from childhood to adulthood and follows kids into as they become adults. And we know it's a risk factor for a whole number of chronic conditions like heart disease and type 2 diabetes. But there are also health and economic impacts that occur in childhood. So some early work from CRE found that the direct healthcare costs of children aged 2 to 4 years with obesity were more than 60% higher than those with healthy weight. And we also found that children and adolescents with overweight or obesity have lower quality of life than children with a healthy weight. And these differences in quality of life become more profound as children grow into adolescence. And we can see that on the slide there, with children with healthy weight represented by that green line and children with obesity, the red line. So there's this real clear need for early intervention. We have good evidence that early intervention is effective, and EPOC CRE researchers have been responsible for generating some of this evidence in a really innovative way. So by combining the data from 4 Australasian obesity prevention studies starting in infancy. So they found that parent-focused strategies that start early are effective and they're feasible, and they can help to establish healthier weight and healthier behaviours. So it's really important that interventions are effective, but we also need them to be cost effective or good value for money. And that's because we all have this classic kind of economic problem of finite resources, but almost infinite wants and needs. And this means that we need to decide how we allocate the resources that we have. And economic evaluation can help in that decision-making process. And it's the comparative analysis of alternative courses of action in terms of both their costs and effects in order to assist policy decisions. So prior to the work of the CRE, we actually had really limited evidence on which interventions represented good value for money in the early years. And so to help us improve this knowledge, we built the EPOC health economic model. And the EPOC model allows us to predict the health benefits and the healthcare cost savings that might result from an intervention. And when we combine the information from the model with information on how much an intervention costs, we can work out whether it's cost effective. So far we've used the model to estimate the value for money of a couple of different interventions, including the POI trial in New Zealand, and also Romp and Chomp, which was conducted in Victoria some time ago now, but it's no longer running. Moving forward, we've got a number of economic evaluations underway, including for infant here in Victoria. So in some preliminary work for infant, we spoke to representatives from 2 different maternal child health centres and asked them about how infant operated within their services. And we then estimated the cost to the services. And this information is now available on the infant website for anybody that's interested. in what are quite preliminary estimates. And I say that they're preliminary estimates because we know that the way that infant is delivered might look quite different across different LGAs. And so a key part of the infant economic evaluation will be understanding and tracking how the program operates in different LGAs so that we can estimate intervention cost, taking into account all of those differences. So to do this, I'll be reaching out to relevant people over the coming weeks and months, and some of you may be on the seminar today. So if you do hear from me, please do get involved and help us to ascertain whether infant represents good value for money. Moving forward, we're also looking at the value of a wider range of outcomes from early obesity interventions. So the value not just related to body weight or quality of life, but also exploring the value of some of those other outcomes that we know are really important. So for example, things like changes in diet or physical activity, or things like well-being. We'll also be further exploring cost effectiveness by special group to see whether some interventions might be more cost effective in certain groups than in others. So whether that's low socioeconomic position groups or perhaps other vulnerable populations. And together, all of this work will give us a really in-depth understanding of the most effective and cost-effective early childhood obesity interventions. And so this information can be used to help inform policy and practice. That's it from me today. Thanks, everyone.
Thank you very much. That's terrific. Just for everyone that's listening, if you could put yourself on mute while we've got a guest presenter presenting. If there's any questions emerging, and I'm just admitting Ellen here, if there's any questions emerging from any of our presentations, please put them in the chat and put them to everyone, and we can look at those as they come through today. So thank you very much, Vicky. Vicky, in your breakout room, I'm just interested to know, what's the thing that you think most needs to change in the system?
Oh, we talked a lot about the value of partnerships and how we can, further strengthen partnerships and how important that is to leverage what exists.
Fantastic. And what part, can you call out an example of a partnership that you've seen work really effectively, that has brought about some real change? What's an example of a partnership or a collaboration or a network that you've seen?
So we had some people that, specifically their job roles are around managing partnerships, and there were some good examples there happening around the Central Goldfield area.
Yep.
But yeah, really, it's probably a higher level kind of conversation about how the economies of scale that we can achieve from leveraging those partnerships and really helping each other make improvements within the system.
Terrific. Thanks very much, Vicky. That was a great presentation. And I'm now going to hand over the reins to Veronica Graham at the Department of Health. So Veronica, over to you.
Thank you, Jeff, and thank you, everybody. Let me try sharing my screen. I'm presenting with Michelle Hollingworth. Let me just get this. Yeah.
All right, Anna, we'll speak soon.
And I'll just ask people to go on mute in the background that aren't presenting. Thank you.
Is that working, everyone?
Not yet. Veronica?
Veronica, I have the slides if you prefer me share it.
Okay, can you just move slide 1 and 2 around, back to front, Conchita? Yeah, and if you're happy to share, that's great.
Excellent. There we go.
Okay.
Thanks, Conchita.
We can still see the side bars, but anyway.
Yeah.
All right. So we might just then, Conchita, are you able to?
Yes, so this one.
Yeah, move it to full screen. Thanks everyone for your patience. I know we're getting quite good at this. And Michelle Hollingworth, are you there with your camera on, and we can introduce?
I think I've got to talk, and then you can see me.
Oh, okay, right. We'll that. Okay.
Is that coming up all right?
Well, this is a bit of a, okay, we'll start here. I just want to pause a moment. We're all here because we have a common interest in early you know, early childhood nutrition. We know it's the foundation of everything good that follows in terms of their development and being the best they can be. And as we go through this presentation from Michelle and I and others, and what we've heard from Vicky, I want each of you to think about, what is my role? What can I do to take action? How am I going to make a difference? What you will see when we finish, there is a lot of opportunity right now for all of you in Victoria, and I want you to consider taking it up. My dream is that we are overrun with demand for some of the things we have freely available to you as very important frontline workers, service providers, local government folk, and so on. So keep that in the back of your mind. This is about action. Okay, so let's move to the next slide, Conchita. Okay, so I'm presenting Michelle Hollingworth is Acting Manager of Policy Reform, and I am Veronica Graham, and I manage healthy eating and active living. We both come from the Department of Health, and we're both in the Public Health Division in the Population and Prevention Health branch. So we care deeply about changing the system to get healthy as the default in the world we live. So next slide. This next slide, you all know this, but we're just setting the scene very briefly to give you the authorising environment that we work to, all of us work to. There is a piece of legislation called the Public Health and Wellbeing Act, and out of that, state governments are required to have a Victorian health and wellbeing plan. And of course, you all know that 4 of the priority areas are highlighted in green. And we see healthy eating, climate change, active living or active play for the toddlers, and no smoking. Okay, next slide, please. Now, there's a policy line of sight from the legislation or the state plan. We have in Victoria these terrific municipal public health and wellbeing plans that fall out of that. And this is the opportunity you all have, and you know very well about this, about tailoring the needs of your particular community, your particular LGA, to embed this sort of work in it. And this is your opportunity to have to be influential, and I know you all are. And you all are familiar with this, but I do ask you to exert your influence, and if you can, get early childhood health and active play, healthy eating in. There's also municipal early years plan, which is even more focused. Okay, next slide. Thanks, Conchita. Once again, this is quick framing. In Victoria, we have the Healthy Choices Policy Suite, which is the sort of the foundation backbone. You can see the links there. You can click on all these slides for more info later. And this is the traffic light system we use in Victoria. So that's just setting the scene, and you see the settings they cover. However, next slide, Conchita. In Victoria, and click again, please. In Victoria, we have something even more special for the early years, and we have Victorian menu planning guidelines for long day care. And they go into the necessary detail about what it is the growing child needs to meet at least 50% of their nutritional requirements whilst in care. Given that we know a lot of children are in care, or certainly were when we weren't in lockdown. We will get back there though. So these guidelines are quite important to us, and we care deeply about supporting childcare, early childhood services to help meet them. And as you all know, there's also the national quality standards that childcare centres need to indicate that they've met, and that come out of the Department of Education. So you'll be happy to know that health and education, we are working together to find out. Right now, we are working together to look at ways we can further support early childhood services to meet these guidelines in a really meaningful way. The stats you see on the right-hand side there are fairly important, I think, and this is where you can start to exert your influence. So you know there's like 1,600 long day care centres in Victoria, and once you take in kindergarten, family daycare, and what's the other one? Anyway, there's about over 4,000 services where young children spend their time under 5. And whilst a lot of them have contacted a service we have called HEAS, we know we are only sure of 27% have actually fully met these guidelines. So there may be more, but they haven't actually told us that they've met them. So this is another opportunity for all of us in the room to sort of see where we're going there and see what we can do to really understand and quantify how many are meeting the guidelines. Next slide, please. So as I mentioned, and I hope every single one of you know this, that we have a free service that comes out of Nutrition Australia. The government, our area in public health, we completely fund this, and it is for you. It is for you and your organisation and for early childhood services to get the free support and advice they need to make those changes and to get meeting the Victorian healthy menu planning guidelines. I can't stress this enough. There's online training, there's seminars, there's community of practice, there's online food checker. You can pick up the phone. If anyone's feeling unsure, just ring Heath and you will get put on a very supported pathway to help you make those changes. And that's something you can do right now. If you're in charge of long day care services, get in touch with them, see, do they know about this? What can you do to support them? And I see Margaret's just popped something in the chat there. So thanks, Margaret. Thank you. And this is the last slide from me before I hand over to my colleague, Michelle. Penny and others have just mentioned the infant program. Infant is, as you know, it's an evidence-based program. It was shown to be effective. Longitudinal studies, it was shown to demonstrate healthy eating changes, no sugary drinks, more healthy foods, less screen time, all of that. And because of the quality of evidence of this, and I do congratulate the Deakin team, in the Department of Health, we are fully funding for 21-22 the first rollout in Victoria to see what it is like to implement this in the real world. So we are learning and we are adapting and we are seeing what is working in different areas, what's working in Gippsland, what's working in Mildura. This is where you come into this. Now, we're live in this at the moment. There is still funding available. There are grants available of $5,000 to help organisations implement infant in their system. There's online training of the infant program freely available for everybody. So if you haven't accessed this yet, okay, there you can and I think Penny, you're going to contact who to in the chat, put in the who to contact the Deakin team. That's Kathy McConnell and Anthea Gregorio. If you email them, you can get linked into this fantastic service that really supports parents with young children and gets them on the right start right from the beginning. And I think that is all from me. And I'm going to pass over now to my colleague, Michelle Hollingworth. Michelle.
And before you do, Veronica, you've really emphasised a point here around what we can do as individuals in our role, yes. Around this. And you and I have been working for a long time in the Victorian Healthy Eating Enterprise. Yes. It's so important, isn't it, that we can actually look outside of the sphere of influence we think we have and try new things out and extend the range of people that we're connecting with, the different programs that we're using. It's really important, I think, aspect that you point to here.
So actually, I will just take an extra minute there. So you're right. I am literally, and Michelle will do the same. I'm laying it fair and square to all of you. Right now in Victoria, we have a lot of opportunity that's freely available to get this happening faster. And our wish is that we are overrun, so that we are saying, wow, look, we can't meet demand. So if whether in your professional life, in your job, whether in your personal life, if you can look around you and see, is this happening in my area? Do people know about this? And make it happen. Start the conversation, connect people up, put them in the right direction.
Right.
Be a catalyst for change. You can do it.
That's great. And in the breakout room after Michelle's little spiel, we'll be asking everyone in their breakout rooms to talk about what the opportunities are that we can start to implement in this area. Yeah. So I'll take the spotlight off you. It's on you, Michelle. Over to you.
Thanks, Jeff. Casita, I'm just checking time. How are we going?
We've got probably 4 minutes, I can tell you, Michelle.
Okay, cool. All right, no worries. Thanks, Veronica. And yeah, one of the obviously key platforms that we have available is our achievement program, delivered through Cancer Council Victoria. And obviously a key focus is on the early childhood services program that you can see there. We've got 1,300 Victorian services signed up, which includes workplaces and schools and everything. So we're really excited around that. And as you know, this is really about a health and wellbeing program based on evidence, and for early years, very much based on their framework and the national quality standards. So, and as you saw from some of the things that Veronica put up, we've still got some work to do in terms of meeting those guidelines as well. I think the other offering here is for, I've worked in local government for a long time as well. You can also be a leader in terms of your own workplace, or if council itself is in the business of providing early childhood services. So how can you be a leader and incorporate that into your municipal public health and wellbeing plan? Concede, I'll have the next slide, thanks. Great, thanks. Now, this is really exciting. This is one of our new flagship investments. So we took on board that we needed something that was new and exciting and can give these bite-sized steps, bite-sized steps in terms of the supporting settings to move forward. So we really want to boost healthy food and drink options in places where kids and families spend their time. And this really will include, as we've listed there, council operated facilities. You obviously have sports clubs and other community facilities that you run, and those community settings. So for us, this really is about providing support for you as local government and all your stakeholders to really boost the food and healthy drinks in their spaces where kids are. It's supported by us, of course, with funding, and led by Cancer Council Victoria in partnership with Nutrition Australia. And I see that Margaret's on the call today. And we certainly want to make it really positive, fun, energetic, able to be achieved. And so high impact actions where we know makes a difference based on the evidence that we know, and some data that tell us about those impacts. We want to celebrate success and build the momentum. And we really want to make sure that we've got that best use of the achievement program, which has been an investment we've had for nearly 10 years now, and how we can build that with the partnership with the Healthy Eating Advisory Service. Thanks. Next slide. Thanks. So these are really four, we call them big bites. So across the settings with smaller incremental change in terms of small bites, and they can choose which ones of these they want to move forward with. They vary a bit around the sports clubs and community-owned settings, which we try to tailor that to make sure we can get our, support tailored to where it matters the most. And we want to encourage those organisations, after they've met these small bites, to continue on the achievement program and really become a health promoting service, or workplace, or school, or early childhood. So we're hoping that to launch this in the next few weeks. So please stay tuned, but we're really excited about this new venture. So next slide, Conceda. Another investment that we're putting into boosting this work. So the last one I talked about is a statewide offering. So that'll be available across the state. We're also using some Commonwealth funding and state funding to actually provide a boosted effort in 13 local government areas, and you can see them listed there. And we really, again, this is a 3-year initiative that will be delivered in, you can see 3 metro and 10 rural, to provide a dedicated workforce to build this community momentum and delivering change where people and children, families spend their time. We really know that to drive change, we need workforce, we need people on the ground, and they will be working really strongly with all the stakeholders in that space, and local government and community health included, of course, and providing that outreach to support the settings and the stakeholders. So we really want them also, they will be getting involved in networks and partnerships, and that's the word Jeff's talking about today. And yeah, as I said, we're hoping very soon you'll hear more about this exciting initiative as well. Next slide, thanks, Conceda. And probably most of you as well have heard about the Vic Health Local Government Partnerships, particularly for you in local governments, across 16 dedicated sites. So but the modules themselves are available statewide to all local governments. So these modules really are around supporting, and thanks to Veronica and the team for pulling together the ones relevant for the 0 to 5 that you can see there around those building blocks and the modules related how local governments can support this area as well. So we might move along, thanks. And obviously we're trying to ensure that, you know, that everything lines up and we see the continuum and the system. And one of the key inputs in that is the Smiles for Miles, which we've obviously links very strongly to oral health and healthy eating. And it's early childhood services that are eligible for this evidence-based support and the opportunities to champion healthy eating. So it works together with Healthy Eating, HEAS and the Achievement Program, and it'll with the Kids Eat Well, and the Achieve Smile for Miles Award allows them to be eligible for meeting benchmarks within the Achievement Program. So aligning our effort to make it as easy for settings to move forward. Thanks, Conceita. So obviously another key area is about breastfeeding. So, and obviously with increasing numbers of women returning to work and also going back to the office, I suppose, we found that obviously there is a decrease in breastfeeding rates across Victoria and Australia, actually quite wide. So obviously the Australian Breastfeeding Association there is to provide support to settings and as Veronica said, even for our own local and our social environments as well. So I encourage you to touch base with them. They're amazing not-for-profit organisations that really are looking at how to better child health and wellbeing and maternal child health and wellbeing as well. Thanks, Conceita. So I think we've finished. Hopefully that was on time, and I'll throw back.
The agenda now. Welcome back, everyone. I hope you managed to have a few minutes off and a bit of a break. We're going to move to the part of the day looking at practical strategies for implementation. And we've got a number of people joining us on a bit of a panel, each of whom occupy a different part of the system. We've got Penny Love. Can you call out Penny? Great.
Hi, everyone.
I'm going to pop you on Spotlight now, just so that people can see you. And the other people we've got are Zoe Barnett. Zoe, could you sing out?
Hi there.
I'll pop you on Spotlight as well, Zoe. Once I can find you in the... For some reason, the list of participants aren't in.
I've just popped her on Spotlight, Jeff.
Thank
I found
you.
Zoe.
That's great, Kai.
Thanks, Kai.
Appreciate that. The other person we've got on this panel is Jeanette Lowe as well.
Hello, everyone.
Great. And I'll pop you up on Spotlight as well. All righty, terrific. So what this session is designed to do is for everyone to play a listening role. We've got Penny, Zoe and Jeanette who are going to share their perspectives on 3 different things. And Penny, I'll start with you from the research perspective, because that's very much your vantage point in the system. What are those effective strategies for implementation and scale up? You know, how do we make this happen in real life and how do we make them sustainable? Yeah, so I'll throw over to you just to open the panel up a little bit.
Great question. People who came to the National Showcase may have also heard some of this as well. So we've had a really great opportunity with Infant to be able to look at how it's survived through a small scale implementation when we had the Healthy Together Victoria funding.
Yep.
And as a consequence of that, we had some sites that continued. And when we went back and asked those sites, what was it that allowed you to sustain when Healthy Together funding ceased? So we learned some really valuable insights from that. And we've been able to go back to all our trained facilitators over the years to see what's happened between training and whether they've implemented, if they started and stopped, if they're continuing. So I'd say that the take home messages from all of that information, that the data that we have is what we call the inner setting. So that's the organizational setting itself is key to implementation, successful implementation. And that really is around organizational readiness and how prepared the organization is. So it comes back to probably a lot of what we heard in the feedback. Does the organization see this as a priority? Does it align with what their business agenda is? And is it something that can be integrated into routine business, not seen as an add-on? If it's aligned with priorities, then it's easier to resource it, to find the timing and the staffing, and not burden the existing workload that the staff or the organisation may have to deal with. And if you can attach it to an external policy, like a healthy health and wellbeing plan or a state policy, that's even better because it allows that organisation to have another lever. So that organisational readiness is key. And the other piece around that organisational readiness is leadership support and management support that can enable that delivery and that integration into routine business, into role descriptions. So it becomes core business rather than an additional sort of add-on. And the final point, or probably two last points, is one that Vicky alluded to earlier on about partnerships and the economy of scale that you get if you can harness together partners within the local government area. And the small group conversation I had, there were some great examples around how that works if you have the capacity in that area to create that partnership. For example, between community health and maternal child health services works fantastically for infant, but we know that some of our regional areas are under-resourced, or in our metro areas, they're overstretched. So you do need that resourcing. And the final thing I'll say is probably around monitoring and evaluation. So one of the other streams in the EPOC project was looking at short form tools that we could provide to our practitioners as well as our researchers to gather useful information that you at an organisation can use to continue building that case of this is what we're achieving. We need to have recurrent support and funding for this. Yeah. And I'll stop there to give the others a go.
No, Penny, that's terrific. And I was going to say, even before you mentioned leadership, that organisational readiness, I know in working with local government over the years that unless you get directors and leaders on board and really championing it from the top, it's really hard to get any traction. Yeah. And that's not a short-term overnight thing to build either. There's often long lead times in getting that readiness in the first place, isn't there?
Oh, absolutely. So one of the great successes that I think Infant's had is that we've connected really early with the maternal child health nurse sector and the coordinators in the local government areas, because they're important influencers, but then again, they still have to influence people above them. So it is a sort of a chain of events, but you're quite right that leadership, those champions, all are fantastic, but they need someone who has the highest level of influence that can say, yes, it's now business as usual.
That's terrific, Penny. And I think a nice throw over to Zoe. Zoe, nice to see you again. We've worked together recently on this very conversation of, you're in the G21 region and you're the executive officer at the G21 around the health and wellbeing pillar. Your experience in this, and particularly focused on some of the barriers that you've seen overcome in your particular region. So if you could add to what Penny said and just share some insights from your perspective.
Lovely. I think I echo everything that Penny has just articulated, and then bringing it down to a more local place-based level. I guess what was important for us from both a PCP and local government perspective was to get that leadership buy-in early. So we had a presentation at the G21 Health and Wellbeing Pillar Exec around what infant was and the evidence base and how easily it connected to the outcomes for the municipal public health and wellbeing plans, for the early years plans, to the state plan. It had leverage everywhere. You look, it connected perfectly and was a nice fit. And so we had agreement across and buy-in across all 5 LGAs to commit to this program And that was a fairly substantial time ago. So that into the lead-in into the new 4-year plan, it was already embedded as part of the actions that would be, I guess, committed to. So we had early success with that, but some challenges have been exactly what Penny has talked about, and I think many of the groups spoke about, was the resource. So depending on what size LGA you are or where you're located, resource has been really, really pushed, whether that be in recruitment and keeping of child maternal health nurse staff, whether that be because of baby booms that have happened through the last couple of years of lockdown, whether that be through, I guess, different systems not being able to communicate with each other and utilise, say, community health staff to deliver some of the program. In conjunction with child and maternal health staff, and the systems not necessarily talking to each other has also been a barrier, and one that we've, at times successfully overcome, but other times had to do many, many workarounds. So, yeah, I think it's especially important for rural services to be acknowledged that they just don't have the capacity. There's a lot around the sleep and settling requirements that were brought in for child and maternal health nurses that, were a bit of a surprise, I guess. And then looking at how do we look into the future around what's happening nationally with the federal programs of the early childhood centres that are getting rolled out as well. There's so many different, I guess, potential possibilities and challenges with different systems and how they all work together. So trying to bring them all together and look at a more, I guess, intertwined system.
Yeah. And Penny and Zoe, it's a real long game, isn't it? We're talking about long lead times and putting things in place, like building foundations so that in the future we can get the kind of outcomes we're after. So Jeanette, I'll throw to you finally, your perspective on how PCPs can embed early childhood obesity prevention. And Jeanette, are you there? You look as though you've frozen a little bit. Can you hear me?
I can hear you.
Oh, great. Terrific. It was just your screen had frozen a fraction. So just your perspective and sharing with the group on embedding early childhood obesity prevention into the work of individual health agencies and also within local government wellbeing plans. And of course, you're out in the Southern Grampians region, so you're in regional Victoria as well. So a few thoughts from you on that.
Yeah, so first of all, I'm just making sure that everyone knows that there's a statewide program of PCPs, and we're basically partnership brokers to actually help build partnerships around health and wellbeing across local areas. And so if you haven't already engaged with your PCP on this, first of all, just call out, because every PCP, I believe, across the state will be running some type of partnership around health, around healthy eating and active living. And so that's kind of the first thing, and that will enable some of the partnerships. So, because I can't reiterate enough about how important partnerships are, and so the PCPs are well connected with the variety of partners, particularly health services and local governments, but a lot of cross-sector partners as well. And one of the things that we found early in the day when we were kind of moving to a systems approach is there's a lot of different people in the system that actually affect early childhood.
Hey, Jeanette, if I could just pause you there.
Don't always work with.
Jeanette, if I could just pause you there.
Could you? That is, and you're thinking about who that is and has the influence is really important. And the other thing in partnerships I think we really need to think about too is how do we actually mobilise the whole community, the passions of the community to take action? Yeah.
Jeanette, if you could just take yourself off video and see if that improves your audio.
Is that any better or not really?
That's much better. Great. So keep going. Keep going.
I'll have to say in Killarney, where I'm sitting, the internet's not always that good. So I'm sorry about that.
That's fine.
I don't know where I got to, but I think my main thing that people I'm known to get on my soapbox about is actually activating and mobilising the whole community and actually helping the whole community understand the whole kind of early years obesity system and the influence they can have into it. And that can be retailers, and sporting clubs, and all the different settings that we think about. But it's having that shared understanding and then a movement to how can I take action where I am.
Jeanette.
It really helps gather momentum that sometimes you don't get when you're working individually. And that's a really important consideration, but that takes a leadership.
Yep.
And a list of people in capacity to actually to get that off the ground and running. But I suppose
Jeanette, I'm going to have to pause you there. Sorry, the internet's really struggling from if you're in Killarney. What we might do is we might see if we can summarise some of those key messages toward the end and provide them for people in the chat or in the proceedings afterwards. I think we heard a good chunk of what you had to say, Jeanette, so thank you so much. And thank you to our other panellists, Zoe and Penny. Penny and Zoe, what did you hear from Jeanette? She talked about getting on her soapbox and talking about things. What do you know about Jeanette's messages that you can reiterate for the group?
She was talking about a systems approach, which Zoe also mentioned. So really seeing a holistic, all the intersections in your community of what affects early childhood and where those points of interventions can be. So, for us with infant, we are looking at maternal child health services and new parent groups, dietitians, health promotion officers. Where do parents go with young children? There's also obviously the childcare sector, and then beyond in the community, where could you reach parents? I heard her mention sports clubs, and obviously as children grow, there's school setting. So within a system, one cog turns the other. I also heard her say community mobilisation, getting everyone involved. So partnerships, I think that's her soapbox. So you want to add?
Fantastic. And I'm also added myself and Jeanette. Jeanette's back with us, everyone. So while you're typing those practical strategies in, I think Jeanette's got the magical gods of the internet are shining brightly upon her now. While you were all out there, we were talking about this idea of communities of practice and networks that share with each other in peer-to-peer learning. And this is where we wanted to end today's session on. And to ask you the question, A, would you be interested in being a part of a community of practice? And B, what would it need to focus on? Jeanette, we talked a little bit about communities of practice and the importance of them for this very broad area of obesity prevention in childhood and early years. The importance of a community of practice from your perspective, what would you like to share with the group?
I think communities of practices are really, really important, a way to share and diffuse information and learnings. But I will put a but in here, Jeff, is that they have to be done well. And that's a fine art to do a community of practice well, because to me, it's about peer-to-peer learning and it's not about just information exchange. And too often communities of practice can fall into that information exchange rather than that collegiate peer-to-peer learning. So it needs a good facilitator, perhaps needs a good focus that engages people in it, and needs commitment.
It does. It requires people to step into the community, doesn't it, and actually contribute.
Yeah, that's right. And sometimes knowing that you may not get a benefit from it, you know, in the first, you know, even 6 months, it might not be until you get through those forming kind of stages that you start to get the value back. But you need to make that commitment up front and be committed to learn from others as well, and have that skill in learning, not just information picking.
Sneak preview of what was coming in our next 5 years of funding with EPOC, but we probably won't do that in the interest of time. But to say it's really focused on the how and the solutions and the practical approaches. So I think it aligns really nicely with the feedback that we've had from this group, that I think everyone's quite convinced about the evidence and the need to do something. We're really now moving on with our evidence to how do we do this? How do we reach the groups that we're not reaching at the moment? What are the models of implementation? How do we scale this up? So it's very much informed from an implementation science perspective. And I guess from a community of practice point of view, you know, we're able to bring the lens of theory and implementation science in our experience, but we'd also very value this ongoing dialogue that we're having with everybody today from local governments around, I guess, your input, so we can work together as researchers and practitioners and policymakers all in the same system. So yeah, really looking forward to those ideas around communities of practice and how we continue this conversation. And just to say thank you all for fabulous contributions and discussions in all of the groups. I've certainly learned a huge amount today about all the structures in local governments and the complexity out there. So just a huge thank you, and also to Jeff for his wonderful facilitation, and Concita for all her work in pulling this together. So thanks everybody. And Concita, do you want to just mention some follow-up notes? And
yeah, so I hope to, I will summarize the discussions for today and any helpful resources that will be useful for implementation. So that will come along in, email that to everyone who registered. The recording will also be on our website. So again, I will email the link, but I'll pop that on the chat there. If you'd like to keep in touch through our newsletter, you can subscribe there if you're interested. But yeah, there will be more coming from us in the next few years. So great partnerships there. Thank you.
Fabulous. Thank you. And Kylie, did you want to close with anything, or has everything been said?
I think everything's been said. Just thank you everyone for their engagement today, and thanks for us bearing with us while we run a few minutes over time.
Thank you, Kylie. And again, apologies for some of the technical glitches today, which do happen from time to time in these events, but I hope you all have a wonderful day. You'll be hearing more from Concita and the team, because everyone who registered will be getting some sort of report back from today's session. And have a great day, everyone. And for the hosts, feel free to stay on so that we can chat a little bit afterwards as well.
Thanks, Jeff.